डॉक्टर साहब आपको इधर आना है।
हाँ
Hello everyone, a very good morning from the convention center at Rio de Janeiro, where today is the first opening day of AIDS 2026. We are indeed privileged to have with us here Dr. Ishwar Gilada, Governing Council member of International AIDS Society and AIDS 2026 Program Committee member. Dr. Gilada, you will please chair this session and say a few words on understanding vulnerability, exploring the social, economic, and occupational vulnerabilities of migrant, mobile, and unorganized sectors. Please go ahead.
Thank you very much, Shubhaji, for having me here. Particularly when you're talking about the migrant labor,
were not able to access the child treatment. So it was a low issue of 95 to 98% HIV in India. In India, much of it. We are saying that it can come. But for us, for the patients, we are not able to provide them with that. So we started from our dependence. That example. Now the fighting losing battle. Not how quickly to die, then very big numbers the check. Then care some of the pharmaceutical companies, particularly Cipla, and the return cost was 4,000, 10,439 dollars per patient per year. Cipla offered that we can provide that for $350 a year, roughly $1 per day. People, they never realized that India can do that. They used to always say that when something is which is very, very cheap, it will not be useful, it will have utilities, it will have efficacy. In 2000, there was a matter going on. The Supreme Court of South Africa. That period, there were 4 or 5 organizations, and I was one of them, which are the different action. MSF, and we fought against 64 multinational companies. And we never thought that a small group of companies there by Cipla in India and small group of people there by some more by NGOs will be able to battle against 64 companies. But was accepted that patients are more important than patients. They wrote that battle. Thereafter, today, is marching ahead and ahead and ahead. Today, India has reached the requirement of 92% of people living with HIV globally. Medicine cost from India is around 1.2% of international cost. If you look at the lenacapavir cost, which is currently $44,000 per patient per year, that is the injection cost $44,000. The package we have to provide them. You don't want to hey, innovate, try to get closer to cure or at least good care. Second is to do clinical trials of anything which is found successful in lab. Both the things are done very well. Third and most important thing, according to me, is making it affordable and accessible, and the partner is required, and that is only India. So, if you talk about a global HIV scene minus India, you can imagine where we stand. So, India's role is just like oxygen or water supply in any city, which is never acknowledged. Without that, we cannot survive. And India is at that situation. People do not give that kind of due credit to India. We do not want to get a credit. We are not for here for credit, but to see the people in the southern part of the world, they survive. They survive of the most of the diseases, they survive of most of the infections, including HIV or any including infection. And today, if you look at pharma capital of the world, India. Vaccine capital of the world, India. GCC, that is Global Capability Centers capital of the world, India. World's 50% of the global capability centers are in India. And India is employing 2.4 million people to run those centers. So I think globally people do not understand the value of India. You always calculate value in sake of money, but how much money is being contributed by XYZ company. But you do not see how many millions of lives are saved by a country or by organizations from India. And therefore, the strength of India is great. I admire the role of DAP here. They have started their fight against HIV more than 3 decades back. They are continuing to today, working for those people which are migrants, which are socially marginalized community, sexual minorities. I think in this way, they try to reach those people which are unreached. Therefore, I admire them, I salute them, and I congratulate them. It is my fortune that I am part of them since beginning, very beginning, since the founder, Raja Muttacharya doctor, was there, and we were together.
Thank you very much, sir. And now I request Mr. Gilbert Simonti, Country Director, Humana People, South Africa, to please shed some light in context of the sex workers and migrants perspective. Over to you, sir.
Thank you very much. Um, So the invitation to be part of that this presentation. So I will talk about our experiences with the sex workers and migrants in South Africa. And I think as brief background, it's clear that there's a lot of work that has been done globally as a response to HIV and AIDS, but I think it's also it's still very clear that there are a lot of gaps and a lot of challenges that are being faced by sex workers and the migrant population around prevention, treatment and care, and all the support services. Humana South Africa is one of the largest organizations who are working with key populations, particularly sex work. We are in the province of Limpopo, where our annual target is to reach 15,555 sex workers. And the majority of them, which you could say the combination of internal migrants, those who are coming from other provinces to Limpopo, because of the economic activities, the mining in in that province. There are cross-border migrants, some who are refugees, asylum seekers, and undocumented migrants. So it is because of this mix, the stigma and discrimination associated with sex work, the fact that a number of migrants, some of them undocumented and illegal, it creates a lot of challenges that as individuals, people face, or the sex workers face. And this really comes into the intersection of human rights and the HIV/AIDS response, because then many of them are not able to easily access quality healthcare. Many of them don't face, they face inequality before the law. Many of them are discriminated, their privacy and confidentiality is at stake. They can't access justice easily. So it is our position and our taking that when these rights are denied or violated, then HIV prevention and treatment outcomes are negatively affected. So you could say, what are some of the barriers that are faced by the sex workers? It is the criminalization of sex work, where because of the law enforcement taking advantage of the fact that sex is a crime, they coerce, they violate the rights of sex workers. Stigma and discrimination is still a very strong barrier because the sex workers are not documented, they are illegal, and sex work is not dignified, so people will not go, sex workers will not go and access health services. Gender-based violence is very prevalent in that space because of those who are organizing xenophobia, poverty, the lack of documentation. So there are quite a number of barriers that discourage individuals from accessing healthcare and legal services if they feel it. So, so as you other people to people, leadership is very critical in addressing the challenges that sex workers face, because it is critical to build generational within the communities. This will also help in accessing those who are not easily accessible. It will also help in identification of rights and the violations that the person will experience to improve and reduce satisfaction. So we've got a project that was working for Finland, dividing and programs around education. So provide information, they provide services, and provide referrals, and at the same time,
We now have Jumendra Pandey, Project Director, Gujarat AIDS Awareness and Prevention, that is Canada, by highest Over to you, Jumendra.
Good morning. Myself, Jugendra Upadhyay, Project Director, GET ISRCD, Gujarat, India. Migration and HIV vulnerability among workers in the unorganized urban sector. Finding it from the gap NGO study 2029 to 2025. My last conference 2024 in the Rio de Janeiro, no space for the migrant, mobile, and unorganized sector. I hope that this conference 2026, the resounding voice, except for the resounding voice, except international society, or the people, migrant, mobile, and unorganized informal sector. Next. Significant structural determination of the HIV vulnerability among workers. Frequent mobility, unstable employment, limited access to the healthcare, inadequate HIV prevention services. This factor increase the risk of HIV and other STIs among migrant and local informal sector workers. This is a parallel. This factor is a parallel. Migrant and also unorganized sector and informal sector workers. Need assessment study by CAP NGO, industrial development expand into the metropolitan city to towns and rural area. The HIV risk environment also changing, necessitating targeted public health intervention. CAP NGO involving the great interview the workers employees in the unorganized informal sector between 2020, 2019, 2025. In finding primary education status, the majority of the respondents had completely only primary education, while only small population had attended the secondary or higher secondary 10+2 education. This is a lack of literacy, understanding about and transmission and preventive measures. Knowledge of HIV/AIDS. Although most participants have heard of HIV/AIDS, but comprehensive knowledge regarding HIV transmission, prevention, testing, and treatment was inadequate. Misconceptions about HIV remain common. Sexual practice. Sexual practice. Consider about get or observe how this risk substance and consistency adoption of sexual practices, particularly regular and condom use. Access to healthcare services. Access to healthcare services. HIV prevention and STI management, counseling, testing, and other essential health services was limited among workers on the informal sector. There is a very good, a very big level, very big level. Accessibility around workplace and residential settlement was reported to the virtual 0%. 0%. Which responded to the of the short-term employment, such mobility, services. Multiple sexual risk behavior. Approximately 27% of respondents reported engaging in the more than one sexual risk behavior, increasing vulnerability, HIV, and other aspects. Practices. Approximately 29% responded reported engaging in the anal sex practices. 2% of the responded, 2% responded reported engaging in the anal sex practices. Unprotected anal intercourse is associated with the higher risk of HIV transmission and underscore the needs for the targeted intervention and education. Observe that hidden key population. The study identified men who having sex with men, MSM, and transgender individuals employed within the informal workforce, whose the sexual partners were primarily other male co-workers. These hidden populations were largely outside the coverage of existing targeted intervention TI program, the national program, TI program, representing significant gap in the HIV service. This is a very big gap, significant gap between the main targeted intervention program and hidden population, hidden key population. Location of female sex worker, a fashionable hotspot where frequently identified as surrounding industrial sectors and construction sites. And the marketing and interaction with the migrant and informal sector workers were common. Changing HIV risk environment. Over the last 15 years, industry expansion has increasing um, including as available hotspot have emerged in these development industries clusters. Highway vulnerability. Highway vulnerability around Plaza established at approximately 50 kilometers interval were identified as a location where transgender person and some MSM engaged in income generation activity, including locating, begging. There is a reported sexual partner commonly including migrant worker, truck driver, local informal sector worker, highlighting the needs for the location-specific HIV prevention and outreach services. Alcohol consumed. Regular alcohol consumed was reported by approximately 30% of alcohol use may continue to judgment
तो फिर हम अपना पूरा करके अगली बार
considers condom use and this is our keep finding
for ready
what is conclusion?
for ready.
This finding the highlighting the needs of comprehensive workplace and community-based measurement strategy, including behavior change communication, improve the condom accessibility,
Hello.
mobile
Hello.
and workplace testing and counseling services, STI management, and
अभी भी नहीं कुछ फर्क पड़ा.
to include migrant workers and key population in emerging various industrial sectors. Thank you very much. Thank you.
All around the world. And teaching pushbacks, like which Eva concerns how are they impacting the sex workers? They are talking about anti-gender pushbacks. How will they impact the sex workers? Thank you, participants and speakers, for coming here. And this was our first session in the Global Village. Thank you very much.
It's our pleasure to be here. Thank you.
Thank you so much for your